After reviewing the videos, I was very appalled, but I know this exists in daily lives, and some we have no idea as a parent, coworker, family member, or any relationship with the individual who is going through an eating disorder. The video shown by 16:9 was so heart-wrenching. At a young age, Andrew was bullied due to his body images were different from others. The young man was purging because he wanted to look better to the extent he starved himself to death. However, previously he had been purging all day and binging when he was experiencing a near-death experience because the doctor told him that his potassium level was too low and he could suffer from a heart attack. I was so distraught that the stigma that men have if they have an eating disorder, they have to be gay, or men do not have eating disorders. I know it is more prevalent for females to have eating disorders than men. However, for a doctor to tell a person that they cannot treat them because of their gender is not acceptable. According to Costandake, Montana, Solero, Orion, and Cosman 2023, eating disorders are health problems and can impair a person's physical health significantly and psychosocial functioning. Anorexia nervosa, eating disorders, bulimia nervosa, or frequently seen disorders in adolescents and adults from primary care setting. Costandake, ETAL, 2023, elaborated on an effective treatment for individuals with eating disorders will be psychotropic medications such as fluoxetine for bulimia nervosa and lisdexamfetamine for binge eating disorder. I know I'm not saying that correctly. Personality traits can be associated with ED, such as obsessive compulsive disorder, dysphoric mood, harm avoidance, characteristics of avoidance personality, and perfectionism. Based on American Psychiatric Association 2021 defines somatic symptoms are significant focus on physical symptoms such as shortness of breath, pain, weakness to a degree that distresses major and lead to problem functioning. In the video, What is Somatic Disorder? Dr. Grundy, he discussed the criterions, features, and modifiers more in depth. APA 2021 indicated that person can meet a diagnostic criteria for somatic symptom disorder by having one or more physical symptoms that disrupt the person's life, excessive thoughts, behaviors, feelings related to physical symptoms with at least one of the following: ongoing thoughts that are out of proportion, high levels of anxiety, excessive energy and time, and at least one symptom constantly present. He stated that talk therapy will be a good technique to assist the client in their treatment. APA 2021 stated that the talk therapy or psychotherapy will help the person to change their thinking about their behavior, ways to cope with pain, improve their functioning, and to alleviate stress. Peeling 2023, a conversion disorder is a psychiatric disorder affecting motor function or affecting sensory functions, which is inconsistent with patterns of neurologic disease and will significantly affect the person's ability to function. In the video, What is Conversion Disorder? Anxiety Out of Control, Dr. Marks explained this disorder to be medically unexplained neurological symptoms. The conversion disorder can also be called functional neurologic symptom disorder. Dr. Marks introduced 8 types of conversion disorders, such as swollen symptoms, weaknesses of paralysis, abnormal movements, speech symptoms, seizures, attacks, special sensory syndrome, mixed symptoms, and sensory loss. Dr. Marks discussed psychotherapy as a modality to assist an individual with this type of disorder. A clinician can assist the client with her beliefs and associate with physical problems to help with connections to help with her circumstances or his circumstance. It depends on who the client is, of course. I just want to share a story myself. Whenever I was counseling, I had 2 clients who were experiencing bulimia or bulimic because they both experienced trauma in their childhood years because one was beaten and the other sister witnessed, who was the oldest, but could not do anything and later abandoned her sister when she was 16 years old because she got married. They reunited years later when their parents died, and they decided needed each other because the older sister, of course, had lost her husband at that time. And they made amends. Until the older sister started putting her duties on her sister and wanted to use her sister at her beck and call. They both ended up being 500 pounds each, and they would eat when they argue at each other, when they had flashbacks of their traumatizing experience, and when there wasn't enough food. Regardless if they exercised or ate less, they could not lose weight. Their health started impacting tremendously. They had to use canes to get up out of their chairs, motorized scooters to go to the store, because they could not walk due to ulcers forming on the bottom of their feet. They always talked about all over body pain because it was exhausting to get up and down. And also their heart would be racing too as well, beating real fast. Both sisters had emphysema and ended up having other breathing issues and heart complications until they both had to be put in a nursing home because they could not care for themselves. Then they died 2 years apart from one another. This was definitely a tear-jerking moment for me because I was the rehab worker, case manager, and then the therapist. So I had been in their life for a long time.